Hi, good morning to everyone. I'm Dr. Madhavi, consultant obstetrician and gynecologist at Motherhood Hospital in Ranapur. So I've given this opportunity to speak with all of you regarding PCOS. PCOS is nothing but polycystic ovarian syndrome. And I would discuss to you what is the cause and how we go about it and how we diagnose it and how we treat it and how we prevent it. So today's topic is about this, and let's start the topic. Coming to some introduction about polycystic ovarian syndrome. We call this as ovarian syndrome. Syndrome means it's a collection of many symptoms as well as the signs. Collectively, we call it as polycystic ovarian syndrome. Polycystic ovarian syndrome, it's not a disease. It's just a hormonal imbalance in a woman. So what happens in a normal menstrual cycle? Our ovaries, in each menstrual cycle, one dominant follicle develops and the rest as a follicle go into a dormant stage. But in this polycystic ovarian syndrome, what happens? There are more than 10 to 15 follicles which are at the same size and none develop to form an egg. So this causes an hormonal imbalance in the woman's body. So what happens? There are a lot of steroids in the circulating blood, and this causes few signs and symptoms which can be detected, and I will tell you about all these later on. So the main problem here is the cysts are not growing. So each cycle you may have regular cycles, you may have your regular cycles, but those are anovulatory cycles. That means that cycle will not release a healthy ovum. So there is no egg released in that cycle, but then you are having the regular cycles. So this polycystic ovarian syndrome, we can divide it into two categories. One is a obese patient and the other one is a thin patient. So both, it's the same pathology which I'll be telling you now. So what are some of the symptoms in polycystic ovarian syndrome? Commonly we see is acne, weight gain. The other one is called as hirsutism, that is abnormal hair growth on your face, on your body, and anywhere where you see like men kind of hair development, and they might lose hair. And irregular cycles. This is the commonest complaint what we generally get in our outpatient department. So people may not have cycles for more than 2 months or 3 months, and for all they'll have an excessive bleeding with a lot of clots and all this happening. So this is a kind of cycle we generally notice in polycystic ovarian syndrome. Apart from that, polycystic ovarian syndrome patients may not experience pain during their cycles, which is called as dysmenorrhea. So that indicates that they are not ovulated in that particular cycle. So any dysmenorrhea, that is pain during the cycle, for a first day or a second day, generally refers to it's an ovulatory cycle. But that's the main thing in polycystic ovarian syndrome. You may not notice any dysmenorrhea during your cycles. And at last, what happens for all this? If you're planning to conceive, it might be a big problem in getting pregnant. You may have to do a lot of investigations and a lot of infertility treatment. So this is the main reason why we are detecting more and more polycystic ovarian syndrome, and at last that leads to depression too. So what are the generally these polycystic ovarian syndrome patients are related with higher incidence of developing hypertension in later part of their life and hypercholesterolemia, that is high levels of cholesterol in their body, anxiety, depression, and when a person stops breathing periodically during sleep, we call it as sleep apnea. And endometrial cancer, because the endometrial lining becomes more and more thickened because of the prolonged cycles, like prolonged duration of the cycles, 2 to 3 months, 4 months duration. So that could be a risk for an endometrial cancer. So for such kind of patients, we do take a biopsy to make sure that everything is fine. And diabetes and breast cancer are the other complications. So coming to diagnosis, first diagnosis and later we'll talk about treatment. Diagnosis, we have three methods of diagnosing it. First, by clinical identification like acne, hirsutism, and the weight gain, BMI. BMI is more important in polycystic ovarian syndrome patients because they have a very high BMI. As I said, we can divide them into two categories. One is obese PCOS and the other one is a lean PCOS. In obese PCOS, the BMI range will be more than 30. So here the main pathology is the fat in the body, which generally the fat in the body too releases a steroid, which is identical to the ovarian hormones. So that could be one of the reasons why they have this hormonal imbalance. So we don't know whether the obesity is the cause for PCOS or PCOS is causing obesity. It's still debatable, but both are interlinked. And coming to the ultrasound features, the next mode of diagnosis is by ultrasound. In ultrasound, what do we identify? We see for both the ovaries the number of follicles. Generally, we diagnose PCOD based on the number of follicles, ovarian volume. So in ovaries, if there are more than 10 follicles which are less than 1 centimeter in size and the ovarian volume is more than 10 cc, we take it as polycystic ovarian syndrome. So this is one of the mode of diagnosing PCOD. And the last diagnostic method would be a laboratory method. Laboratory method which includes the estimation of the hormonal levels, which includes the estrogen levels, progesterone levels, LH levels and FSH levels. Here the most important one would be the LH level. LH level in PCOD patients will be high. So the other mode of investigation is by knowing the blood sugar levels. Generally the PCOS patients have a very high insulin resistance because of the obesity. So what happens generally, the blood sugar levels do show some variations in such patients. So insulin, that indicates indirectly that the insulin resistance in the body is quite high. So one of the challenging treatment in PCOS would be to bring down the insulin resistance in PCOS patients. So we do blood tests like insulin levels as well as the normal blood sugar levels to rule out whether those patients are associated with any insulin resistance in their body. And so these are the three ways of diagnosing. So any two of it comes as positive, then we consider them as positive for PCOS. So that is first initially by clinically, by examining by acne, loss of hair and irregular cycles and hirsutism, change in the voice like manly voice. All this we take into a consideration in diagnosing it. So, and the next option is the ultrasound. We can do both transabdominal scan as well as a transvaginal scan. Both has the same result. And the last one would be the laboratory examination. So coming to the treatment. So for us, it's a very challenging thing to treat in this modern setup, because most of the patients in and out we see are positive for polycystic ovarian syndrome. This is attributed to the lifestyle changes which is recently seen. So most of the patients do have a sedentary lifestyle and they eat a lot of junk food. That's the main reason what we have found why the incidence of PCOS has gone very high in the recent years. So the main challenging thing, so how we treat this is whether you're planning to conceive or you just want to treat for PCOS. If you're planning to conceive, the line of treatment is different. If not, then we have certain treatment options left for us. So if you're not planning to conceive, then the first mode of treatment would be diet and exercises option. So coming to diet, which is very important in PCOS patients, that at least if you lose 5% of your body weight, you will have your normal cycle. So this again indirectly indicates that the obesity is the main reason for this hormonal changes in the body. So we would suggest all the PCOS patients to at least lose 5% of their current body weight. And coming to the dietary patterns, avoid taking a one single major meal, so that you can at least divide your meal so that you're not giving a complete burden to your body by having one complete meal. So you can divide your breakfast into 2 halves, and similarly as your lunch and as well as your dinner, so that the insulin level, the insulin produced in the body, is utilized for the amount of food you have. And the foods to be avoided would be like oily fried foods and high caloric food, which would be a rice or potatoes, and junk foods mainly, which there are chances that you will be putting on your weight. And the next option for losing your weight would be aerobics, yoga. All this would be a better option. So the first line of treatment is always with diet and exercises. So we tell people with polycystic ovarian syndrome, we give them a 3 months time period. So with diet and exercises, and we do check their weight. Once this diet and exercises pattern is followed for the 3 months course. Once they're done for the 3 months course with the diet and exercises, the next line of modality will be medical line of management. Medical line of management, if people are not planning to conceive, then we will be giving them oral contraceptive pills for a period of 3 to 6 months. So this is just to regularize your hormonal cycle. So generally what happens is a pituitary gland in the brain which releases the FSH and LH hormones, which in turn act on the ovaries to release the LH and FSH. So this cycle rhythm has to be picked up in patients with PCOS. So when you are on oral contraceptive pills, generally we start these pills on day 3 of the cycle, and they continue it for 21 days and then give a gap of 7 days. So what happens when you are on these oral contraceptive pills, the rhythm in your body, that is from the pituitary hormone, that's the brain releasing hormone, and your ovarian hormone is regularized, and your body is tuned in such a way that it has to follow that rhythm. So that's the main reason why we give oral contraceptive pills at least for a period of 3 to 6 months. And with these medicines, there is a chance that you may lose your weight also. Along with this, you have to follow diet and exercises pattern too. As I said, the insulin resistance are quite high in polycystic ovarian syndrome patients. We do have some anti-diabetic drug. It doesn't mean that you are a diabetic, but then to bring down the insulin resistance in the body, an anti-diabetic drug should also be added. So by adding these two drugs, we have seen at least 92% good results within 3 to 4 months. So this is the second line of treatment. We don't initially start off with medical line. We would advise the best option would be following the diet and exercise pattern. If the things are not shaping up, then we go ahead with the medical line of management. So this is what about the medical line of management. The third option would be, as I explained to you about the ultrasound features, that the ovarian volume is big enough and there are too many follicles developing in your body. So what we do have a surgical option where we do by a laparoscopic surgery, where we puncture the number of follicles and reduce the volume of the ovary. But this is not a complete solution for the PCOS. It is just to this option we have kept only for people with infertility issues who have tried for a long period with all ovulation induction medicines, and it is not working for them. Only then we resort to this one of the remote treatment, which we generally don't use, but this is also one of the treatments for polycystic ovarian syndrome. So these are the 3 modalities. The main modality would be the diet exercises. The second one would be the medical line of management with oral contraceptive pills and an anti-diabetic medicine. The third one would be the surgical procedure by laparoscopic ovarian drilling. We call it as ovarian drilling. So coming to the infertility patients. So patients who wanted to conceive with polycystic ovarian syndrome, like patients who have been married for more than 5-6 years with polycystic ovarian syndrome, they are planning to conceive. Then we start them with infertility management. So we don't give oral contraceptive pills or anything for those patients. We do give them an anti-diabetic medications like metformin for the insulin resistance to come down, which has to be continued if the patient becomes pregnant. Along with it, we supplement with ovulation induction drugs. What is ovulation induction drugs? That we help these patients to give an ovulatory cycle. That means we help the patients for the egg to be formed in the ovary. So we give such medicine and we monitor by follicular scans. What is a follicular scan? Generally, these medicines are given from day 3 of the cycles for 5 days. And then we follow this by ultrasound scan to see how the ovum is developing. Ovum means the egg, how the heads are developing. So we just follow it up with ultrasound scan from the day 9 of the cycle. Every alternate days we will be checking out when the egg is going to release, and based on that we would suggest you certain injections and all that to be taken. So this would be the infertility line of management. The challenging thing with PCOS is mainly the obesity. So that's the main thing which everybody should take into consideration and do follow exercise and diet pattern. So this is the treatment option. So how do we prevent? I feel we have a very sedentary lifestyle as of today's generation taken into account. So we have to change this as an healthy lifestyle. So regular walk, at least half an hour in a day, exposure to sunlight, and a very diet which is low in carbohydrates, rich in proteins, and low in cholesterol should be taken. And losing weight is a big challenge. So the basic thing in PCOS patients is the main hormone levels in the body is on a higher range. So that's the reason why they see the male pattern of hair growth in such women. So we have to bring down those main hormones in their body. That's the only way. Only way is by losing weight. So with a proper diagnosis and lifestyle changes, PCOS women can get relief from this condition. The major problem to treat PCOS is infertility. So at an earliest, I think PCOS patients should become pregnant. That could cure their problem for later purpose. So this is about the PCOS, that is polycystic ovarian syndrome. Any queries will be taken up. There's a mail, there's a query box where you can put questions which will be addressed. lost already 10 kgs, and I think they still have this condition. So what really, it's a good thing what you've done, that you've lost 10 kgs, but that really constitutes about 5% of your body weight. You just calculate and see. But still, you need to follow this diet pattern, and you have to, for what is the main concern you are having with PCOS? Is it the cycle pain, or is it the infertility problem what you're facing, or what is the main issue you're having? So I just need to know about that. Okay, you still don't get your regular cycles in spite of losing your 10 kilos. That's really good attempt what you have made so far. So I would suggest you to continue whatever you're following, your diet pattern and exercise pattern, since you have successfully lost around 10 kilos. And I would like you to come and meet me in Motherhood Hospital. So the second line of management, that is the medical line of management, will be started. So I think with that, you might be better. So I would suggest you to come and meet me at Motherhood Indiranagar. I will be available on weekdays between 5 to 8 p.m. Yeah, the next question what we have got is, can we continue metformin while trying for pregnancy? Yeah, definitely you have to continue, because metformin gives us a very good result with ovulation as well as the pregnancy outcome. So what happens is, polycystic ovarian syndrome patients are more prone to develop gestational diabetes in pregnancy. So these patients, we should continue metformin so that the diabetic thing will be taken care with metformin. So no harm in continuing metformin even when you're planning to conceive, even during pregnancy. Definitely, see what happens, PCOS is mainly that you're not ovulating. We have got a question regarding, will polycystic ovarian syndrome condition change after first pregnancy? What happens, as I have explained to you, that polycystic ovarian syndrome, there are too many follicles developing, and at last not a single follicle becomes a dominant follicle. So that cycle goes as an anovulatory cycle. So during pregnancy and soon after pregnancy, the ovarian volume comes down because they are not ovulating for a period of 9 months during the pregnancy, and post-delivery, at least for 6 months, they will not be ovulating. So the things change and the hormone levels come down. So definitely after the first pregnancy, there might be at least 70 to 80% improvement in this condition. The next question what I've got is, I'm suffering from PCOD sometime. My periods are regular. I wanted to know about the weight loss. I'm planning to conceive. Please tell me solution. Okay. If your cycles are regular, I think only the diet and exercises would be better. And if you're planning, and if it's not happening for more than 6 months, you can come and consult us. So you take a time period at least 6 months as a natural way to conceive if your cycles are regular, but follow the diet pattern as well as the exercise pattern, whatever was discussed earlier. And the next question by the same patient is there a chance of miscarriage? See, miscarriage, there are many reasons why a miscarriage can happen. But one of the reasons could be hormonal imbalance. As I said, polycystic ovarian syndrome is nothing but a hormonal imbalance. So as soon as you become pregnant, you have to consult a gynecologist so that they will give you some supplements like progesterone supplements, so that the hormonal changes is taken care. So that's the only thing. Otherwise, it's not a risk that each and every patient will have a miscarriage. That really doesn't happen. Next query is, diagnosed with PCOS in 2015, and doctor has recommended diet 35 tablets for 6 months and Ovinate SR, but after the treatment it's irregular. So as I said, have you lost the weight, and are you following the diet pattern and the exercises whatever was discussed along with the medical line of treatment? And few, we name it as resistant PCOS, that is, no matter whatever treatment medically or even when you take orally and lifestyle changes, diet changes, exercise changes, there may not be any improvement with few of the patients. So we term them as resistant PCOS. So in such patients, what we do is, if they are planning to conceive, then we have to definitely help them with infertility line of management. But if they're not planning to continue, they have to continue this oral contraceptive pills. At least give a break once if they have taken for a period of 6 months, then give a break at least for the next 3 months and then again restart. Because it's a harmful thing taking oral contraceptive periods for more than 6 months. So that's the only issue with oral contraceptive pills. Otherwise, no harm in taking if you're giving a break regularly. Okay. So the next query is, there's a chance of twins if we conceive with PCOS. So what happens in PCOS? There are too many follicles developing. So as I said, a scan can show you that more than 10 follicles in an ovary. So occasionally, because I said the hormone level, LH level is quite high in PCOS, LH is mainly required to release the eggs from the ovum. So whenever there's the level of LH quite high, there might be a chance that 2 follicles are releasing an egg. That could be a reason that there is a chance for a twin. Otherwise, most of the PCOS patients end up with infertility line of management, that is the doctor helping them to conceive. So any form of infertility line of treatment, the chances of twins would be high. So that could be another reason, and the last reason could be age-related twins. PCOS patients, generally they don't tend to get pregnant as early. So what happens as the age progresses on, again the normal LH level in the body increases and more chances for the twins. So these are the 3 main reasons why there is a chance for a twin pregnancy. The next question is there any relationship between PCOS and thyroid? There's no relation between PCOS and thyroid, both are different, and if both show some issues, both has to be treated. The next question is, taking antidepressants for the past 6 to 7 years, 25 unmarried, does it have any effect on my period cycle? It depends on what medications are you taking, like what antidepressants are you taking, and definitely it may not affect your your menstrual cycle. The next question is, non-obese PCOS planning to conceive, following a healthy lifestyle, done a follicular study. There are multiple small follicles less than 10. I'm having irregular cycles. Can you please suggest course of action? So I would like you, if you're planning to conceive, and if you're following a diet pattern and exercise pattern, to meet us at Motherhood, so that will help you by giving you some medication so that you ovulate and try by natural way to conceive at least for 6 cycles. We will try and do a follicular studies. So the next question is, with diet pattern and medicines, this PCOS condition was kind of settled down, but again when the diet became irregular, again the cycles got. So you yourself have written the answer also. So that diet and exercise pattern has to be followed, and I would suggest you to continue the diet pattern and exercise pattern. If you're planning to conceive as early as possible, so that the chances of curing PCOS is quite high. Okay, the next question is, had a molar pregnancy last year, is it connected with PCOS? No, molar pregnancy is completely different and it's not related to PCOS. The next question is PCOS curable? I would definitely say that it is not curable, it can just be prevented. What we can do is, because PCOD again in the later part of the life is associated with diabetes, hypertension, hypercholesterol levels, that is high cholesterol levels. So whatever we do now, it is just to make sure that the things don't get worsened. And it's not a complete thing which can be cured by medicines or something. But yes, if the patients are lucky enough, they might get back to the regular cycles and they might start having the ovulatory cycles if they follow all this. But the lifelong effects with these hormonal imbalance is still there. So they need to go for an annual health checkup, like for a BP checkup, for a diabetic to rule out, and cholesterol levels, thyroid levels, all these levels has to be ruled out by an annual health checkup. Was diagnosed, the next question is, diagnosed of PCOS and had medical treatment to get pregnant. So when I try for a second baby, is it again necessary to go? Not really. If you are having your regular cycles, as of now, it may not be required. The next question is, emergency contraceptive pills irregularize your cycle. Yeah. Those high pills which are being found in the market, yeah, definitely you will have irregular cycles and your cycle rhythm will completely change. So that's the reason we say to avoid high pill which is not safe. The next question, patient was diagnosed with PCOS almost a year back and has been advised to take cycling tablet for 3 to 7 to enhance egg release. Yeah. I have been trying for almost 1 year now, but did not get success. I also have my septal removal last September. Please advise how to increase the chances of fertility, because we have been trying for almost. Yeah. See, since you have tried with cycling tablets for 6 cycles, so what happens, we have to find out the other causes of infertility. Maybe PCOS may not be the only reason why you're ending up with infertility. You need to check up the tubal factor, that is whether your tubes are normal, your uterus is normal, and the other hormonal levels in your body are normal. So the next option, what you have messaged to us is that you had some issues with the uterus. So there was a septum which has been removed. So the next line of management will be taken care by your gynecologist. If they feel that again they can go ahead with an ovulation induction, or whether it requires an higher form of infertility treatment like IUI or IVF. So the next question is, diagnosed with PCOS last year and given crimson 35. My periods were regular for 3 months and was in unbearable pain. But after 3 months, my periods was again irregular and was given normal tablet for 6 months till cycle not normal. So I would suggest you to go with these oral contraceptive pills as well as a metformin, which is an anti-diabetic tablet. So the results are really good if you combine both these for a period of 6 months and then give a break and see how your cycles are regularized. Okay, so if your doctor has advised for IUI, kindly go ahead with an IUI procedure. Any more questions will be taken up, or anything you can mail it to us so that we will reply by mail. The next question is, what is the right age to get married for women with PCOS? I would always say you need to deliver before 30 years. The first baby should be delivered before 30 years. So you decide when to get married. Any more questions? Or if you think later, you can email to us. We'll reply back.